Hello everybody, welcome back. It's Nancy again. Today I want us to talk about medication administration. Those that are involved in this exercise of drug administration, prescriptions and dispensing from the pharmacy and any other that is involved in medication. Then this is for you. You must know the rights of medication administration so that we can have safety for our patients. So without further ado, let's go through the medication rights, the rights of medication administration. First and foremost, the very first one is the right patient. For you to avoid the erroneous way of administering the wrong patient that was not intended, is for you to do the right patient identification. How do you do it? First of all, you need to know them by their first name, last name, and their date of birth. Of course, patients can share names, but I don't think whether they can share the date of birth. And if they do share the names and the date of birth, then you have to go to the next identifier, which is the number, the administration number to the facility. That is, some people call the inpatient number. Some hospitals call it the hospital number, others call it the patient number. These are unique numbers to every patient. They never share. And so you have to identify them by these two identifiers: their name, the two names, and date of birth, then the card number or the hospital number. And there are some identifiers which you cannot use at all to identify the patient, like the room number, the bed number. You cannot do that because patients keep on shifting to other rooms. Others keep going for a referral or for transfers. Then others, of course, they get well and they're discharged home. And of course, some succumb. And so stick to the two identifiers. The next one is the right drug. If a certain patient was supposed to get Lasix, for example, and you give them metformin, it will be wrong because that is the wrong drug. And another one is the right route. We have various routes of drug administration. We have intramuscular injections, we have oral administration, we have subcutaneous, we have sublingual, we also have intradermal, and even through the NG tube. Those are all. Others, we have IV administration, that is intravenous administration. And there are some drugs which have, not even some drugs, but the drug administration route that is prescribed, it must be followed. You have to give it through that route. Otherwise, you are going to miss. The next right is the right time. A patient is supposed to get the drug at 7 a.m. You have to give it at that time. If it's not possible that you administer the drug at that time, then you must do it at another time, but you must consult with the prescriber. Otherwise, you are going to miss. For example, some drugs which, like for diabetes, we use the sliding scale. And so, depending with the sugars, with how the sugars are, that is when you give. So if it's not like you give it at 7, because if you take the blood sugars and you find that they are within the normal range, you don't have to administer, but you just get in touch with the prescriber, then you discuss. Otherwise, with the sliding scale, you don't stick to the time. But if a drug like is supposed to be given 3 times a day, that is after 8 hours, then you have to stick to that. Another right of drug administration is the right dosage. My friend, if you don't stick to the right dosage, then you are going to mess with the client. And so you have to do the right dosing for the client safety. And if you find that the prescriber did prescribed a low dose, then you have to find out why. You have to confirm. Every time you are in doubt, you have to confirm from the physician, from the healthcare provider who prescribed the drug. And if you feel like this drug is, the dosage is too much, same thing, you have to confirm so that the client, so that we play safe with the client, because at the end of the day, client safety is crucial. And so let's stick to those rights of medication administration for our patients' safety. Next time, we shall talk more on relevant drugs and their side effects and anything to do with some drugs that we're going to discuss in future. Otherwise, wish you a good time as you continue putting into consideration of the drug administration rights that we have discussed. Bye bye until next time.